inside, and this they've already failed. So what do we do in patients who've already had ICSI? Then we use technology, highest technology, to improve the success rates. And highest technology means you choose sperm 7,000 times magnification. ICSI you choose only at 400. So in IMSI you choose sperm 7,000 times big, and once the top class sperm is selected, you inject it into the baby, you inject it into the egg, form the baby, and put it in an incubator called the embryoscope, which is like the human body. So the quality of the embryo is much better. And also there is an inbuilt camera which keeps on taking pictures automatically of the embryo development, and finally software analyzes all this data and it selects the best embryos and gives it marks, 80 marks, 90 marks, 100 marks. So you choose the embryos with the 2 top marks, and before you put it into the uterus, you use the laser, thin down the shell of the embryo, coat it with a sticky substance called embryo glue, then you put it inside the uterus so that the success rates improve also and go up to 80%. Now to help the embryo to grow further, we give injections to keep the blood in the liquid state all the time, and once again we also give injections to decrease the natural killer cell in the lining of the uterus, and we also decrease the immunity, the antibody reaction inside the uterus, and therefore we help the embryo to continue its journey inside the uterus. We also give lots of hormone support, and then we actually try to support the baby well, so that, and we give medicines to prevent the uterus from rejecting the baby, so that the embryo carries on in its growth and we are able to deliver a baby after 37 weeks of pregnancy. Sometimes in the previous history you find that there has been some problem with the mother's chromosome or the father's chromosome, or they have had repeated miscarriages. In that case you actually use the laser to take a few cells from the embryo, and these cells are then subjected to genetic testing, and they give you a result saying recommended, not recommended. You take the recommended embryos, then you put it inside the uterus, then your success rates in the next pregnancy is better, and you also have a good quality baby and miscarriages are lesser. So you're successful and your miscarriage rate is also lesser. So all these technologies help to decrease the IVF failures, and sometimes the egg quality is so bad and then you have to recommend a donor program. This is very rare. In that case we actually, if we feel that we need to recommend for a donor program, then because of genetic issues, then we have to do it. We have to do PGT and select the correct embryo. We don't recommend donor egg for this sort of situation. But after several attempts, the AMH is very, very low, then we ask for a donor egg program. Some patients have issues with carrying on the baby. So they have heart problems, kidney problems, or their uterus is full of fibroids, full of small blood clots, and in this case we recommend that they go for a surrogacy program. Today India's laws are such that surrogacy program is not easily available, and therefore we try to avoid surrogacy program as much as possible. Instead, all the difficult surgeries, even if it is difficult, we try to remove the fibroids, we try to remove adenomyosis, and we give several medicines to help the baby to fix in the lining. The major problem with IVF today is having a thin uterine lining. So if the uterus lining is very thin, then you do a hysteroscopy, send the tissue for testing for tuberculosis or any other infection, and if these infections are there, you correct it by treating it with medication. Then you put the embryo inside, and if it's still rejected, then you do a X-ray of the uterus, and if there is any defect, then you repeat the hysteroscopy, and then after that you put back and you do something called a scratch test at the time of hysteroscopy, where you put scratches in 4 angles. It helps the lining thickness to improve and the blood flow to improve, and therefore the baby fixes better than before. So these are all the technologies that we use to improve success rates in patients who have actually failed many times in their endeavors.
Ma'am, as you are running best acute infertility center in Chennai, then tell us about more 3D laparoscopy.
Yeah. So 3D laparoscopy is one of the very good technologies which has really improved the success rates with the laparoscope. So with the 3D, it's like seeing a 3D camera or a 3D picture, 3D cinema. So everything you see big, and therefore you see each muscle fiber, you see each blood vessel separately, and everything is so big that you can operate to the best of your expertise, and you can improve you can minimize blood loss by only touching the actual blood vessel without destroying the surrounding tissue. You can actually separate the normal tissue from the abnormal tissue, and during the process of suturing, whenever you take out a myoma, you suture so well that you reconstruct the uterus and make it normal like before, and you minimize blood loss, you give a better outcome, and therefore you can even give normal deliveries to patients who have had fibroid surgery because the suturing has been so perfect. And when you do a 3D laparoscopy for a chocolate cyst, you're able to take out only the cyst without destroying the normal tissue. You're able to take out fibroids and suture well, and even when you join the tubes in a patient with blocked tubes, you're able, because the magnification is so good, you can suture the tubes very perfectly, layer to layer, and therefore the success rates in recannulating the tubes, that is in making the tubes open, is much better, something to the tune of 75-80%. So that because you're able to do such a good job because it's done at great magnification. So these are all the advantages of the 3D laparoscope.
Thank you, ma'am. Thank you for your valuable time. Thank you, viewers. আপনাদের যদি ইনফার্টিলিটি রিলেটেড কোনো কোশ্চেন থাকে, আপনারা স্ক্রিনে দেখানো নম্বরে যোগাযোগ করতে পারেন। ধন্যবাদ।